threw, threw together some slides for folks who want to follow along sort of with the presentation portion of the meeting, but I'm really looking forward to the discussion afterwards. Let's see, can folks see that? Yeah,
Yes.
great. Adjustment here. My end. Make sure everyone still see that.
Yes.
Great. Okay. Okay, so glad to be here with you all. We're going to do just a quick overview of domestic and sexual violence and the impact on families with young children. Talk about some best practices for being values driven and trauma informed in the work that you all do for and with families who might be impacted by domestic and sexual violence. We won't do that perfectly in that order, which is fine. And we're going to start with a quick conversation about trauma and trauma informed care, and then get a chance to talk more. And I'm looking forward to hearing about your experiences here. I always want to start with, especially with a group like this, a really interdisciplinary group of folks sort of coalescing around a really critical outcome, is that the work that you're doing is really important to the lives of survivors of DV and SV, even if that's not the focus of your work. We all know there's transformational power in family support programs, and that's why we do a lot of what we do. So I was hoping that as folks are sort of like settling into the conversation today, if you feel so inclined to pop into the chat, like how it feels to support young children and families in your work, or what core values you bring to the work that you do with families. I'm always so grateful to stay sort of like rooted and grounded in those pieces when we start to unpack some of the more difficult experiences that those families might have, and that really require us to stay oriented toward those values and those feelings when we're doing our work. So just some reflection questions to start. And feel free to throw some thoughts in the chat if you'd like, that we can come back to, and also just to sort of mill on while you're thinking about this topic. Um, And a disclaimer, right? This topic may feel personal or triggering for some, right? Recognition of and care for the ways that you are impacted directly by these issues is critical for being able to provide. Ooh, that says patients. Sorry, I mean families, folks, clients. I talk to healthcare providers a lot. That's the main crux of my work, is working with healthcare and public health providers. But um, I do want to say that there is no space with this many people in person or virtual that does not have survivors of domestic and sexual violence in it. And we are talking among and with experts and lived experts, people with lived experience, not just to those folks. We're not just providing services to survivors. Survivors are providing services to survivors of violence, and that's really important. So not only is the experience common, but understanding that we are impacted by our work when we are thinking about violence and exposed to the violence of others or violence we've experienced ourselves. And to be able to sustain ourselves in our work takes some stewardship, and sort of thinking about how we're affected by trauma and suffering and the violence that we can be exposed to. So just a quick note on trauma and thinking about trauma-informed systems of care and trauma-informed policies and programs. Right, of course, trauma is any event or circumstance that results in some kind of harm, with a lasting adverse effect. As defined here by SAMHSA, I find that they still have some of the best information and accessible information around thinking about trauma. And in examples of traumatic experiences include physical and sexual or emotional abuse, childhood neglect, community violence, natural disasters, poverty, separation, and loss, right? We're talking about experiences we all know that the families that we work to support have. And it's important to be thinking about how to respond to those experiences when we're creating systems of care and programs for families. Um, and for a slightly deeper dive, because I think it can be useful to imagine the creation of trauma-informed programs as needing to really be oriented towards the impact that trauma has on children, on families, on parents and caregivers, really what's going on for people, right? Trauma is a normal and adaptive response to an abnormal and overwhelming situation. You know, there's distress and impact that's intended to ensure a person's survival. And we're talking about experiences that could be perceived as harmful or life-threatening, that are harmful or life-threatening, things that are outside of our control, um, and that sort of like really create a level of stress that puts a person into survival mode. And those short-term activations or long-term impacts of trauma are things that really are intended to keep a person alive. They're sort of physical reactions that keep people alive, but they're also the kinds of responses that folks are developing around major stressors to be able to adapt, and to learn how to cope with, figure out how to cope with really adverse experiences. And so, in many ways, the folks' trauma responses that people have are not responses that they are fully in control of, right? They're responses that are integrated into who people are, how we are in the world, and how we move through the world as sort of a adaptation to a loss of control and power. And this is really at the root of a lot of the experiences of families and people who've exposed to domestic and sexual violence, is sort of a way of being in the world that has served to protect them from violence and harm in one specific dynamic, but absolutely can create barriers and limitations to being able to access supports and resources that might help them thrive in other places. Right. And so just briefly, some guiding values on trauma-informed services, right? Like these all feel like on their face, very, obvious things that we're all working towards, and aspiring towards. And I've learned that one of the most challenging aspects of thinking about families who have been impacted by intimate partner violence, domestic and sexual violence, etc., is like when these values are shining through and when they're not, and trying to figure out like how do I bring some sort of like connection to moments where actually I see that this program, this policy, this way of doing this, providing this service is not really sort of like rooted in trust for the person in front of me. It's actually, the opposite. Or what does it mean to have services where most of the folks who are providing them really have not been equipped with the resources or the training to demonstrate an understanding about the prevalence and the impact of trauma in the lives of patient of families. So I'm really hoping that we can come back to sort of guiding values that are actually like quite present, that I find in most of the work that folks are doing to support families throughout the state, and to stay rooted in them, and then to ask the hard questions about when these things are really leading the work that we're doing, and when these things are being hidden or not able to shine through because of other factors in our programs and in our systems. So briefly, just some working definitions, right? There are so many definitions of domestic and sexual violence, intimate partner violence, gender-based violence, just to put us on the same page or to have folks sort of reorient to the topics here. Domestic violence is a pattern of abuse or behavior in any relationship that is used by one partner to gain, maintain power and control over another partner. You'll hear it most often, and the lens through which folks are really talking about this in the most robust ways right now is intimate partner violence, and it can include sexual violence and other forms of violent behavior and abusive behavior. We'll dive into that a little bit in a second. Sexual violence means that someone forces or manipulates someone into an unwanted sexual activity without their consent, and that can exist inside of a, you know, um, intimate partner situation, former partner situation, or it can be something that occurs outside of that kind of relationship. But these are the types of experiences that form a really large umbrella that we're talking about around intimate partner violence, and the types of abuse that might exist in the family system that children might be exposed to. And some quick statistics just for folks to have them here, right? This is national data. About 1 in 3 women and 1 in 4 men report having experienced some type of severe physical violence or intimate partner from an intimate partner in their lifetime. Some Vermont data, if that's helpful for people. Nearly 1 in 6 adults report that they have had an intimate partner physically hurt them. And for youth, nearly 1 in 9, so about 10% of high school youth who dated someone during the past year reported their partner physically hurting them on purpose. Um, last year, the Vermont Network Against Domestic and Sexual Violence member programs served about 1,400 children directly in their services to support survivors of domestic and sexual violence, right? The children exposed to domestic violence, young children exposed to domestic violence and sexual violence in the state. Um, so these experiences are common. They are impacting the family systems, and they are impacting them in ways that affect resources, access to care and services and supports, mental health, and all kinds of another range of experience of things that make it possible for families to survive and thrive throughout Vermont. I always like to throw a power and control wheel in a presentation like this when we're doing a high level overview. I just am not always sure how many folks have seen it or are familiar with it. If you've seen one before, or you're familiar with this, wonderful. If not, this is a power and control wheel. And it can be a really helpful visual tool just to get a sense of what we're talking about when we're thinking about intimate partner violence. That it's not the same as conflict in family or relationships, but that there is um, a pattern of behaviors and of experiences rooted in power and control over someone, and that those experiences or those behaviors essentially are tactics that can be used to control, manipulate, harass, or discredit a person. And the power and control will just provide some examples of how that can happen. Importantly for this group, I think we're thinking about examples like using children or child custody or the child welfare system or child protective services in a way that can discredit a parent or a family member or control a survivor of violence. We're talking about things like isolation and extremely, this is a common tactic where one person might isolate another person in that family from their friends, from their family supports, from other social services and systems like childcare providers. We're thinking about economic abuse and trying to the tactics that can be used to control a person's finances by ruining their credit or not giving them access to their income or harassing them in their place of employment. Right? There's so many ways in which power and control can show up in a family system, and the range of violent experiences here. Every single one of these prevents barriers to access to all services, including the early childhood system. Right? When we think about the forms of violence that can happen inside of a family, and the potential that they have to create major limitations on access to early childhood systems and resources, right? Yes, physical and sexual violence is a major part of deviant SV, but it's not always happening. And it's certainly not always the thing that's going to cause the most significant barriers to the accessing services and supports that children with young families need. So we're thinking about all of the forms of abuse and control and manipulation that can be pervasive, and that need to be addressed in order to improve access to services and supports for families with young children. Um, Another sort of quick thing that I like to sort of like pop in here, or maybe we'll go here. I tried to cover a couple of the most common questions that I think of when or that I hear when I talk to folks who support and provide services to families with young kids. One of the most common questions that I hear is, why do people stay in relationships, and sort of what are we supposed to do about that? And specifically to why people stay in violent or abusive relationships. And it's really important to be thinking about the fact that abusive, violent relationships and family dynamics may still have happy and loving moments, right? Survivors of domestic and sexual violence often love their partner and have hope that things will change and improve, and rightly so, right? Oftentimes, the risk of leaving a violent family dynamic or an abusive relationship are much more dangerous or life threatening or life altering to the survivor of the abuse than staying, right? People exiting or ending abusive relationships are at much greater likelihood to be killed by their abusive partners, right? Really careful safety planning is required to reduce those risks around fatality. This risk increases exponentially during pregnancy and the perinatal period. And survivors of violence know this, right? So a lot of the time when we're talking about staying inside of the family system that has abuse present, we're talking about people actually making, in many ways, some of the most protective factors that they can think to make to their own safety, their own health, and their own well being, which translates regularly to parents making the safest decisions that they can make for their young children. Um, and thinking back to the power control wheel, right, people may stay in abusive relationships for a range of other reasons, right, to maintain their housing, to keep their relationship with their children, to protect their immigration status, to stay connected to transportation. There's just countless reasons why a person may choose to stay in an abusive or violent relationship dynamic or family dynamic, and make those choices in thinking about the resources that it actually brings into the life of children and families, their children and their families. Right. And of course, when this happens, the effects of DV and SB on families are intense and severe, right? There's effects to children's trauma and the impact on their safety, right? Of course, the potential for actual physical abuse or sexual abuse of children. But importantly, this presentation is not on child abuse. And I can imagine and hope that you all get a chance to have those conversations as well. There's also the just the experience of seeing or hearing or learning about violence as a young child in a family when you're exposed to domestic and sexual violence. There's negative effects on the family ecology, right? Just like the internal and external resources necessary to maintain a healthy and well family ecosystem, loss of income, loss of housing or housing instability, loss of connection through isolation, not being able to stay plugged into extended family, the degradation of social, experiences, of educational disruptions. All of these things are protective factors that can be dissipated when domestic sexual violence is present in a family system. Of course, direct harm to the child, not just physical injury or abuse, but behavioral, emotional, social, educational, and developmental impacts and effects on parenting. There's negative mental health impacts like depression, PTSD, anxiety, substance use or misuse, loss of parental authority, potentially like the loss of an ability to offer a stable or safe parent figure regularly to a young child. Energy might go towards addressing violence and minimizing the harm instead of energy put towards addressing a children's needs or wants, right? Interrupted routines. And then, of course, a parent who might be causing harm or using violence in their relationship may not be able to also parent due to incarceration or separation from the family. And there's the sort of ongoing separation from the natural supports that parents need to take care of young children. The other conversation that I have most often with folks in the early childhood system about domestic and sexual violence, and that pops up regularly, is just the intersection between experiences of violence like this and mandated reporting and the systems that we have available to support families here in the state. And it's important to know that the system of mandatory reporting does not make it safe for people to disclose that they are experiencing domestic violence or sexual violence, right? It's a system that was created to create safety for children and other vulnerable people, but not specifically to create safety for survivors of DV. And there's a lot of work happening inside of our child and family services divisions to figure out how to create safety for families. But ultimately, the system of mandated reporting is designed without sort of deep connection to creating safety for a survivor of intimate partner violence. And so my guidance usually for folks who are working in the EC system is to just start with some really foundational elements around mandated reporting, to know your state's laws around reporting child abuse. Yes, intimate partner violence or sexual exploitation or other things could be part of the conditions for abuse, or could be a precipitating factor, or they could be the direct cause of harm, right? But it's critical to understand what needs to be reported, is an event or a circumstance or an action that creates a reasonable suspicion of child abuse or neglect. And and just to be able to recognize that the presence of domestic and sexual violence in the family system may not be a reportable situation. This is the type of training and detail that I think a lot of folks in who are working with young children and working with people who are supporting young children in throughout the state can use to sort of really get rooted in what are the policies for the state, what are the policies of my program, and how do I really think through what my requirements are and what the best practices are for being able to respond to domestic and sexual violence at my program. And so I started just thinking of stories that I've heard and the conversations that I've had most recently with folks in early childhood systems, and asking myself, like the $1 million question is like, how prepared are folks who work with young children and families to, how prepared are they to respond to domestic and sexual violence? And I did a quick reflection, and sort of these are the things that I came up with for recent conversations. I was thinking about a child care provider who was telling me about a parent who showed up who appeared to be intoxicated or impaired, and picking up a child, but it wasn't entirely clear. I was thinking about a case manager, a social worker who just witnessed some behavior that made them feel uncomfortable and, bordered on violent, but, like didn't really know where to take what they were seeing. I was thinking, and that was sort of like towards a family member, not towards a child. I was thinking about the experiences that I've heard from many folks working with families at parent-child centers in the last year or so. I've had a lot of time to work with folks who are just like experiencing disrespect and aggression and threat from people who are parents and caregivers of young children, and they're experiencing those things directly and trying to figure out what to do with those experiences. And then I came back to this story that I just heard last week, which I threw in here because I was working with somebody. It was a caseworker who was telling me about a family and a really difficult situation that they had to sort of navigate, where uh, this woman ended up calling an abusive ex-partner as a single parent because they just needed someone to hold the baby, right? So it didn't end well. And this caseworker was trying to figure out, like, what could we have done to prevent this? How are we supposed to respond to this? What was I supposed to do here? What supports could have been helpful here? And I was reminded of reviewing some of the family engagement results from the VCAP update, the action plan update with BVF's committee here, and the number of respondents who were single parents who were just talking about what they need to see in this state in order to be able to thrive as parents of young children. And how many of them were just like, as a single parent, this is nearly impossible. Like it almost doesn't, if you have all the access to all the resources in the world, this is impossible. And how that connects so directly to the experiences of survivors in this state of domestic and sexual violence, to know that even in the best of circumstances, sometimes you just need someone to hold the baby. And then if these sort of dynamics are at play in your family, in your community, in your relationships, and the only person that you can turn to is someone who could potentially or has been violent towards you or someone else, you might make that choice to have them come and hold the baby because there's just no one else to do it. And the sort of the complexity here for early childhood providers and for people who just support those folks are just that it is really difficult to figure out how to support child safety and well-being needs and the family system when domestic violence or intimate partner violence is present. And we're getting a much better sense of this, I think, right now, but there's a lot to sort of be unpacked here about what do early childhood providers and supports and programs really need to be able to see the entire picture around the family system and figure out ways to support families that that make it possible to hold these really difficult family dynamics around domestic violence or sexual harm, and understand how what resources make it possible to access services that sort of see the entire range of experiences that a person might be having when they're seeking support. We're not here to offer solutions. I'm super excited to chat with you now about sort of this discussion and what your experiences are. But I just threw a couple sort of ideas into this slide for folks to sort of be percolating on and thinking about, okay, what do we need in our programs, in our services? Where are the gaps, etc. And so I think that we should be thinking about policies that promote confidentiality and safety. We should be thinking about universal education. And I don't love the term normalizing, but it's normalizing the experience, right? So many families are exposed to domestic and sexual violence. So many young children are exposed to domestic and sexual violence, right? Everyone should be able to bring up important information about what that experience is like and to talk about it, in order to better understand the needs of those families and young children and how to provide supports. Of course, training and continued education for providers is key. This is not something that folks should be expected to just know and understand on their own without greater supports from their organizations and their programs, to sort of dive into the topics and to think about prevention and consent-based education that allows us to decrease the risks of harm to young children and families, through sort of like other evidence-based strategies around protective factors and education supports. And these are the discussion questions that we had in the agenda. Kate, I can turn it over to you to facilitate that if you want, or I can leave them up here or take them down, however feels great for diving into a conversation.
Sure. Yeah, I can put them in the chat if we want to return
Great.
to
Yeah.
gallery view and see each other while we discuss. And I'll pause the recording now and I can put it back on when
I Thank you. I'm going to share a little bit of information about how we at the Vermont Network are thinking about kind of state level policy work, and some kind of opportunities that really overlap with early childhood systems. Particularly, I want to highlight some work we're doing on supervised visitation programs. Um, I have been at the network for a little over a year, so I will not claim to be an expert in all of these systems, but I'm happy to share what I know, and hear from you all. And I can follow up with more information if there are any things that y'all want to dig into that I can't speak to today. Let me share my screen. Okay, can you folks see that okay?
yes.
Amazing. Um, so first off, I just want to share a little bit about like the overall purpose of the Vermont Network's policy work. So, what we are doing when we are kind of engaging in community, when we're in the Vermont State House, is advancing state level policies that uproot the causes of violence and also support the well-being of survivors, their families, and Vermont communities. And we do that in a few different ways. So the first way is that we, at the Vermont Network, have a membership. There are 15 independent nonprofits that I'm sure you all work with in your communities that provide direct services to survivors and their families and provide prevention programming. And so we want to support these folks, survivors and people who serve them, in taking part in the process of making change and having their voices heard at the State House. And there are a few areas that we work in. So we spend a fair amount of time in judiciary committees working on criminal and civil legal responses. We work in correction systems. Particularly, we are active in conversations around women's incarceration, and services for justice-involved youth. We do plenty of work in kind of human services. So I know a lot of people think about legal system responses to domestic and sexual violence first, but human services and health-focused responses are really also a key part of serving survivors and their families and community. Economic justice work. Economic abuse is an element of nearly all domestic violence relationships, and it is also a significant barrier to accessing safety. And so we do work to ensure that folks have their basic needs met, and are able to therefore access some elements of independence in their lives. Support for services. So we, like many of you, I know, including BBF, spend some time in the appropriations committees, advocating for funding for our services. And then both in kind of human services realm and the education committees, we do work on in safe environments in K through 12 schools and supporting youth. That is the briefest overview I can provide of the way that we structure our policy work, and I'm sure I'm missing many important things. But one thing in particular, when we had this invitation and opportunity to speak with you all, the first thing that I thought of was supervised visitation programming, because it is an issue that we worked on this past year. It's an issue we're looking forward to working on next year. And I think there's some really kind of key overlap with the folks who are engaging with BBF and the interests of supervised visitation programs. So I'm curious, either kind of with a like physical hand or in the chat, like how when I say supervised visitation, how many folks like know what that is? Okay. I'm seeing a good number of hands and also some like kind of okay. Well, um, so the briefest overview then is that supervised visitation programs provide a safe and appropriate setting for child visits with a parent for the protection of the child and the non-abusive parent. So these are visits that are supervised by a staff person in a particular location. There could be safety concerns. There also could be a need for a professional to support the transfer of a child from one parent to another and provide a safe setting for that. And there are a number of different ways that people kind of find themselves in supervised visitation programmings. Primarily, participation is ordered by DCF or the judiciary. There are a small number of folks that also self-refer into supervised visitation programs. And so what that looks like in Vermont, there are 6 programs that are operated by nonprofits. Some of these are housed in member programs that serve domestic and sexual violence providers. Some are housed in organizations that serve children. So for instance, like Winston Prouty houses the supervised visitation program. Very recently, there were 7 programs in the state, and so I have not gotten a chance to update my map, but very sadly, the program in Rutland was no longer able to offer services and has closed because of the limited state funding that is available to these programs. So as you can see, that kind of scary black center is where there are no programs available to families. And so this results in more informal arrangements for visitation and also just limits parents and families and children's access to all of the things that supervised visitation centers provide, from kind of direct visits to access to support systems. The Vermont Network coordinates and provides training, supports on making referrals, and other things that supervised visitation programs need. And we also do advocacy to ensure that supervised visitation programs are able to provide their essential services in community. But I will be honest, it's been a tough few years and an even tougher past last year for supervised visitation programs. So historically, supervised visitation programs have gotten about $38,000 annually to operate in state funding. I know. And so when you think about staff and space, it is just really not doable And that is why you see so many counties without coverage. But even further, supervised visitation programs were cut for this fiscal year that has just started this month. And so they went from about $38,000 in state funding to operate to between 18, 19,000. And so we know that a statewide and sustainably funded network of supervised visitation programs is what Vermont families need, but we are not trending in the right direction. But we are very grateful to legislators this past year for recognizing that there does really need to be some attention and work towards this network of services. And so there is a legislatively directed study included in the budget on how to ensure sustainable funding and statewide coverage of supervised visitation. So I was like, this is the worst slide ever, but I thought it might be helpful for you guys to see the actual language that established this study. So the study's due January 15th. DCF and the judiciary are kind of jointly working on this report. And the report is to include sustainable funding for statewide coordination, equitable funding. So right now, each supervised visitation program gets the same amount of money. Is that an appropriate way of funding these programs? We're going to look into that. And also looking at access for residents in counties that don't currently have supervised visitation services, how to create programs that they have access to, or think of another model to ensure statewide coverage. And then, of course, DCF and the judiciary, really key stakeholders in this conversation, but also the Vermont Center for Crime Victim Services, the Vermont Network, supervised visitation providers, and many others, including families that use these programs, folks who work in the early childhood system, are going to have an opportunity to kind of weigh in and provide information to inform this report. So what is next on this issue is that providers are going to continue to serving families as they're able. The judiciary and DCF are going to work on this report and information. I think there are many legislatively directed reports where I know where the recommendations are going to land, or I feel like I have a pretty good guess. And this is not necessarily one of them. I think there are a lot of different ideas on the table, and I'm really excited to engage in this process and carry forward recommendations from the report to better serve families and these supervised visitation programs. So that is a very high-level overview of a very complicated system with many moving parts. But I hope that it was valuable priming. And I would really love to hear any questions that you have, any things that you want to discuss or perspectives that you have on supervised visitation, or any other questions you have about domestic and sexual violence focused systems and policy change.
Any questions or connections to your work and what Charlie has presented for us? Thank you, Charlie.
Of course.
Definitely making me think as we're editing the early childhood strategic plan, that there are elements that are missing. So we have some work to do.
Well,
Like supervised
Beth,
visitation, I know is a gap, but I don't actually think that that's represented in the plan, the current draft.
well, Beth, let's talk. I would be happy to connect with you on that. So Jen put in the chat, are there any peer-to-peer supports for parents and families experiencing DVSV? Kiona, I think this might be a better question for you if you have thoughts to speak to here.
the first thing that I think of is the advocacy programs throughout the state that support survivors of domestic and sexual violence, and who also often offer various peer-based and facilitated support groups and healing-centered services. Um, I don't know of a sort of like statewide resource for peer-to-peer connection, but certainly many of the member programs of the Vermont Network are offering healing-centered supports for survivors to come together, to connect, to build community. And the best referral I can think of there would be to reach out to local programs to hear what kinds of services they're offering around peer support. Those kinds of things tend to vary quite a bit from program to program. So that's the first place that I go around peer to peer supports. Um, I will say that over the last few years, we've been sort of wrapping up a project called Healing Together, which is regional. It is in the Northeast Kingdom, primarily in the northern part of the state. But Healing Together was a healing centered support project for families who are experiencing domestic violence that was really focused on community building and connectivity within and among families. And so I'm thinking less about regular individual sort of like programs or support group type experiences or community building experiences, and more about these sort of projects that came out of that project. And I'm thinking, so last year they ran something called Camp Together, which was a summer camp, a sleepaway summer camp for families, for parents and their children to get together and spend a week at camp with each other in a peer-led and healing-centered space. And so I like that was the most transformational program I've seen come out of our office in a really long time. It was really special, but I just want to lift it up as sort of like highlighting the importance of peer-to-peer support, the importance of community building as a healing-centered practice, and as one that allows for violence prevention as well as for healing and transformation. And projects like that have like come out of some of the member program organizations at the network, as well as the Vermont Network's larger initiatives.
I'm glad I passed it to you, Kiona, because you did such a great job. I am putting in the chat just a map of our member programs and their service area, in case that is ever kind of valuable to you or you want to take a look. And I'm also putting in the chat our end of session report from this year. Again, not an exhaustive list of the issues that we worked on, but I think it could be helpful context, or perhaps, down the road facilitate some other connections between the issues that we are working on and the work that you all are doing.
Thanks, Charlie. I captured those for the notes too, so we'll have those links and share them out with folks. I think now might be a good time for us to make some connections with the work that you presented and that you're doing at the Vermont Network with the Building Bright Futures policy recommendation process and the strategic plan, of course, to but let me pass it over to Martha to talk about our policy recommendation process. And then I think we'll have some great opportunities for collaboration from there.
Awesome. Thank you, Kate, and thank you, Charlie and Kiona, for your presentations. There's so much to unpack. Really great. Looking forward to those future conversations. So I am Martha Braithwaite. I am BBF's policy manager. I've worked with the rest of our policy team over the last year to sort of shepherd our policy recommendation process. And that's what we're here to talk to you a little bit about today. And this conversation has been a really amazing example of how this process can work. Every year, BBF as a statewide network puts forward a slate of 10 to 12 policy recommendations that are the issues that we've heard from network partners from committees like this one and from SAC members are sort of the urgent issues that need policy action in the coming year. And so what I'm going to do today is just sort of report back to you on some of the policy recommendations from last session that this committee had a role in, and then brainstorm and hopefully make some linkages from the discussion today about what the 2026 policy recommendation slate could look like. I am going to share a slide, and I think just a really important connection or challenge in the work that we do is so many times things get sent to legislative study committees, just like Charlie's last slide. And it is so important that we stay in communication with each other and with the legislature to kind of make sure that those legislative study committees aren't where issues go to die, but that we are really tracking them and acting on them in the next session. So can you guys all see the slideshow of this cutie on a swing?
Yes.
Awesome. All right, so I'm going to try to give just like a 5 to 7 minute overview and then jump in to spend more time on discussion. So the policy recommendations related to the COAT committee last year, we had some focus on TANF and ensuring that all children that are eligible for TANF are also eligible for childcare. You guys spoke a little bit to some of the challenges of accessing those services for basic needs when a family is experiencing something like domestic violence. And so this recommendation was intended to lessen those barriers and lessen sort of the paperwork and administrative burden. There hasn't been a lot of movement on this particular policy issue, but there is a group of people convening to talk about TANF implementation and what the best policy changes are going to be to make that more accessible to families and more responsive to families' needs. Another policy recommendation that was sort of voiced in this committee was related to the child care welfare information system. The state of Vermont has one of the most outdated data tracking systems for the child welfare system, and it's just created a outsized burden on those kind of social workers that Kiona was talking about, needing to be really fully present with families, and their job is so hard and so complicated. And when they are burdened with entering the same data 6 times in 6 different systems, they're less able to be present for that kind of work that Kiona was identifying as so important to families. So the state is in the process of updating their data and information system. And there are some, the devil's always in the details, right? So the good news on this recommendation is the RFP has gone out and this process is moving forward. And there's always some challenges and importance to stay in dialogue. And the Office of the Child and Youth Advocate has been a really strong lead in making sure that that system continues to develop in a way that is child and family centered. The last policy recommendation that sort of is directly related to COAT and a big issue this legislative session was housing. We all know that there's a housing crisis in Vermont, and sort of the 3-pronged approach to establishing affordable, sustainable housing for families, requiring this short-term, immediate crisis solution for sheltering families, support for families navigating housing instability with the continuing services, and then just a long-term investment. We can't solve the housing crisis without there being more houses, right? And so this sustained investment, BBF is working with partners to monitor how this system is working on all 3 of those fronts. This year was a very challenging session in the housing sphere. Governor Scott did veto the emergency housing bill. While the budget, there were increased investments made in some other housing supports in the state. And I think it's important also to note here that there have been significant federal budget cuts that have impacted housing vouchers available to families. So when we're thinking about the big picture of family safety, stable housing is a really important foundational piece, right? And a lot of oftentimes when Kiona was talking about like the impossible decision matrices that families face, housing is often a really big piece of that when your choice is, living on the street or having a roof over your head with maybe what we might not consider the most safe environment. Folks are facing some hard choices, and so housing is just so foundational to all children's safety issues in Vermont. We're hoping to see more movement on that next year. Just wanted to kind of bring back to top of mind, in addition to domestic and sexual violence impacts on families, some of the other topics that this committee has discussed in recent months. You all had a presentation on the status of public benefits and Medicaid and SNAP, and then substance use disorder in the perinatal period. And I think this slide kind of brings me to like, okay, what's the work here, right? I don't want to leave with like an overwhelm of, oh my God, it's all, the sky is falling and there's, there's so much work. Where do we begin? I think the purpose of the policy recommendations every year is, as a network, we identify sort of a set of sort of the most urgent and the most actionable policy issues. And we put those forward, and it's really a dialogue between committees like this one and the SAC and other partners and our data and policy team. So I'm just going to give you a quick overview of the process that we're kicking off in July and August. So we are holding these kinds of brainstorming conversations with each committee. And then we will take from that and develop a survey for you all to dive a little bit deeper into your priority areas. And then we'll come back to you in September with the overview of those surveys, and we'll sort of workshop to get to more specific, what are the issues that feel most important for COAT to put forward to the State Advisory Council for this year's policy recommendation slate. And then there'll be a vote on that slate in November. So that's kind of the process that we are kicking off here. And the last thing I will say before I just open the floor for discussion is this is happening this year alongside a new strategic plan. So we're kind of living between two organizational states where there's a way that this process, the policy recommendation process, has happened in the past. And there's a way that once the new strategic plan is approved and finalized, that some of these strategies and policy areas may live within the new strategic plan, and this process might be more of a prioritization process. So just thanking you all for your patience, as we know we've asked you for a lot of input in a lot of different ways, and if that feels duplicative, please let us know that. And this year you may see these processes work a little bit differently, but this year I think we are learning and weaving them together. And the most important thing is, when we're looking at policy recommendations for the 2026 slate, do they fit within the new strategic plan? So that's where maybe not specifically named, but just do they connect to one of the goals? And that's the work that we're surfacing here, is how do we make sure that we continue to build that alignment? So I think, speaking to the new strategic plan, the two goal areas that a lot of COAT's work is rolling into are goal one: all children and families have their basic needs met, and that's economic security, food security, housing, and transportation, and all children and raised in healthy and healing environments. And so that speaks to mental and physical health, safe communities, and families feeling welcome. So I think I want to invite us now to just this great big brainstorming of, what would you all put forward as the most important topics and issues, or really specific policy recommendations for the next cycle. And I want to name that Kiona did offer that really important point of policies that promote confidentiality and safety and that education. And then Charlie left us with that specific issue of access to supervised visitation sites. So those are definitely two data points that I'm taking away from this, and will continue to carry forward. So I'd love to hear if people want to dive deeper on those issues or expand into any of the other issues that you all have discussed in the past. Do you want me to continue sharing, or do you want to go to?
Yeah, let's take down the slideshare, but thank you, Martha, for highlighting goals, the new draft goals 1 and 2. And I think we have an opportunity in our committee here. Originally with the 2020 VCAP, we're talking about goal 1, all children have a healthy start, and a significant change in the new draft strategic plan update, which is still very much in process, is that we now have two goals. So one is really focused on basic needs and economic security in goal one, and then goal two is safe, healthy, um, safe and healthy environments. And I think that's an opportunity for us to highlight a lot of what we've talked about today in the way that violence impacts families, and also all the intersections that we talked about with human services and health issues. So I would love for folks, let's take our last few minutes to start that brainstorming of what we've heard today that most resonates with you, that should be a priority for this committee to raise up in the policy recommendation process. So please chime in.
I see
Marcy.
Marcy put in the chat funding for primary prevention in schools to teach youth how to have healthy relationships free from violence. And additionally, training for adults on how to put protective factors in place to keep children safe.
Thank you, Marcy.
Marcy, I'm just following up if I can. Marcy, is there a curriculum that is targeted for certain ages?
Yes. So our Healthy Relationships project, are you hearing me okay? All right. Is from preschool all the way through 12th grade. And it is evidence-based and also well evaluated. And this is what 85% of schools have chosen to fulfill their child sexual abuse education mandate. It's a health-based program, and I really see it as what we do for the next generation, you know, so that we're seeing less of this problem in the next generation. And also to help youth who may be in situations where they're experiencing intimate partner dating violence already, to know how to get assistance.
Thank you, Marcy. What else? We're quiet this morning. I think it's the summer lull, but
Yeah, I'm looking at folks who are on and just thinking about like connection to reach up, connection to home visiting, some of those pieces. Just we don't hear it now. It would be great to hear via email.
Hi, this is Margaret. I'll chime in from Home Visiting Lens. I didn't state earlier when Kiona was presenting one of the discussion points around strategies that work well to prevent or mitigate harm when working with families impacted by violence. And I just really wanted to give a shout out to what I think has been a really great collaborative effort to provide some training on the Connected Parents, Connected Kids curriculum. And I know Kiona's working on that as well within the healthcare sector, but we have held some trainings for home visitors specifically. And it's just been empowering, I think, for the workforce to have universal conversations about healthy relationships and provide resources without any disclosure or questions. But it's been a powerful training, and I'm just bringing that forward into the conversation.
Yeah, thanks for that, Margaret. And I do think that just sort of the general shift that has happened over the last year or two throughout state systems, especially in the Department of Health, but in other places as well, around moving towards universal education practices and moving away from disclosure-driven practice as the on-ramp to intervention. I think that is just a really nice, helpful reframing of how to make more trauma-informed systems, that a person doesn't have to sort of like use disclosure as the mechanism by which they get the services that they need, and particularly around supports that disclosure could decrease their safety, potentially like increase their risk of harm, things like that. And so the Connected Parents, Connected Kids training is just one of a number of ways in which I think people are thinking about universal education over things like screening, intake, or next to things like screening and intake, to try to sort of like make more accessible systems that are primarily disclosure just driven as a way of accessing services.
Thanks, Kiona. I just wanted to add, I think for the home visitors, and just share a little bit further that I think our collaboration with the domestic violence unit and sharing some policy regarding domestic violence in the setting of child protection was really helpful and informing for home visitors to hold these delicate conversations, to have a clearer picture of what the policy is, to better support conversations around domestic violence and children in homes.
Yeah, this is really helpful. I appreciate the feedback. And as you think and, step away from this meeting and go on with your day, as we're creating policy recommendations for next year and as we're drafting the strategic plan, we are really interested in just that menu of programs that are working. And so please feel free to reach out to any of us, Kate, Beth, myself, or Anna over email, as things come up, and we'll be back again in September to further the conversation.
Yeah, thank you for sharing, Margaret. It's always good to hear about the programs that are working well and how we can replicate collaboration and success in other places. So I will just leave it there. We have opportunities. This is the beginning of the policy recommendation process. We'll go into the fall, and we're in the middle of the strategic plan update. So the link that I shared, the website I shared earlier, and I'll share it again in the notes, has copies of each of the goal language right now. And I definitely think that we have room to grow on areas around child welfare and protective services in particular. So there's a feedback form on that website, or you can email me directly, and we'll gather that input as we revise the strategic plan over the next few weeks, and hope to have another revised draft the mid-late August timeframe. We also have a state advisory council meeting on Monday, July 28th, coming right up. I'll put that registration link in the chat. This meeting will be a public forum for us to continue the conversation about what the most pressing issues are. BBF will use this information to fill in gaps in the strategic plan and inform the policy recommendation process. And it will be an opportunity for many decision makers and public and private partners in the room together to problem solve and share with each other what is most top of mind right now. Thanks. I'll make sure to bring all of these great links that you're sharing in the chat into our notes too. So I'll send that out with everyone. And then if you're able to and you want to contribute to, in particular, I would love this group's feedback on goal 2 of the strategic plan by the end of the month, by July 31st. That's the deadline that we're hoping for there, for at least to be incorporated into that mid-August draft. And big shout out to Kiona, who is a state advisory council member and a member of our strategic plan advisory group, who has made some incredible contributions to this process and to the work that we're doing on the strategic plan. So thank you so much for collaborating with us on that. So with that, I'll give you 4 minutes back for the rest of your day. Thank you so much for being with us, and let's keep this conversation going, and please connect with us. I'll also send August meetings on policy recommendations so that we can stay in the loop before our next COAT meeting in September. So thank you all. Have a great rest of your day. Stay cool and be well.
Thank you all.
Thanks, Kiana. And thanks, Charlie. Oh, I think she dropped off. Have a good one.